Hello, this is Dr. Dale again. This video is on alphabetic list of problems on letter H. Today I'm going to talk about hyper or hypoparathyroidism. If you follow up my previous video, I have talked about some endocrine axis regulatory mechanism through the hypothalamus, pituitary gland, and the third level or target organs including thyroid, parathyroid, and adrenal glands, and also the organs from reproductive system. So today I'm going to talk about I have talked about the hyper or hypothyroidism, and today I'm going to talk about the hyper or hypoparathyroidism. First of all, is any emergency situation associated with this hyper or hypothyroidism? Usually not, unless there's some other comorbidities, because this hyper or hypothyroidism a lot of time just symptomatic. I'm going to explain why. But can you manage at home? I don't say it's managed, it's just that you do not know you have it. Because like I said, a lot of people with this parathyroid abnormalities carry it with it and just live the life without knowing it. So I'm not saying that you can manage, because if you find you have this kind of problem, that means probably it's severe, so you need to really manage by the physician, either through the surgery or through medication. So basically, what are the parathyroid? What kind of function they have? That's the question you probably in your mind, or probably you have heard about it. Anyway, parathyroids are the four small glandular organ sitting behind at the four corners of the thyroid. Their size about ½ centimeter or even less. And the function of this parathyroid is secrete the hormone, of course, called parathyroid hormones. Parathyroid hormone. What are the functions for this parathyroid hormone? Basically, it's regulate the calcium metabolism to maintain the homeostasis of calcium in the blood level. As I mentioned before, calcium is very important in the muscular contraction and signal transduction in the heart for the rhythm, maintain the sinus rhythm, and also maintain the cardiac muscle contraction, build up the muscle strength. So this calcium is very important. However, the blood level of calcium lies in very narrow range. So from 9 to 11, for example, if beyond 14, that's really dangerous, usually indicating for malignancy. Otherwise, like from 9 to 11, it's really narrow, not like, for example, TSH, it's like or sodium or potassium. There's a little wider range, but this calcium has this narrow range. So if it is so the regulation is kind of very delicate sometimes. The fortunate thing is usually for this hyper or hypocalcemia without any comorbidities, probably probably asymptomatic, or the symptoms very subtle, like once in a while feel cramps or feel that's probably one of the most common symptoms of the hypercalcemia. Hypocalcemia. Hypercalcemia usually is not quite common, like I said, unless you have abnormalities, like so basically this parathyroid hormone is to increase the calcium. Unless you have this adenoma for this parathyroid, or unless you have the bone disease or the malignancy, can cause this elevated hypercalcemia, which can have symptoms, mainly the symptoms of hypercalcemia is feel thirsty, subtle. A lot of people just without cause just feel thirsty, or can have arrhythmia of the heart if the calcium is really high. Of course, tend to form the stones, especially for those who had kidney problem or not rehydrate very well. So having said that, parathyroid hormone, back to the main topic, it's regulated through the bone absorption or release calcium, or increase the calcium deposit in the bone to regulate the calcium level. That's the main pathway. Of course, it can regulate other pathway like the kidney and also regulate vitamin D through vitamin D3. But the main mechanism, main pathway is through the bone regulation. So, for example, if the parathyroid hormone is elevated, for those had adenoma, for parathyroid adenoma, which is increase the function of parathyroid hormone, and will increase the calcium. How? To dissolve the bone, to take the bone, the calcium from the bone, release to the blood. So this kind of people, particularly if elderly, older people, female, for example, had risk for osteoporosis, and if this subtle, undiagnosed parathyroid adenoma will really double risk for the osteoporosis, which really the complication for this is tend to have fracture after the falling. So this is kind of for the older women or older people. This is another significant or could be serious complications. So if the parathyroid hormone is not enough, then the calcium level in the blood is low. Usually for this not enough parathyroid hormone from the complication of the surgery, a lot of time, not a lot of time, once a while, it could happen. Surgery during the thyroid, surgery of the thyroidectomy, accidentally take off the parathyroid. I think it occurred probably 3 decades ago quite often, because at that time the parathyroid function was not quite clear, or the scenario like this, patient just had the thyroid tumor removed and a couple of days later developed this spasm, muscle spasm, and test the calcium is very low, and then scanning find out the parathyroid was removed at the same time I removed the adenoma of thyroid. But nowadays it's not quite common unless I have the radiation therapy, for example, for the thyroid, it might damage the parathyroid. So basically this parathyroid hormone is there, it's important, especially for those who have other medical conditions. In normal people, this parathyroid hormone, its function kind of hidden and to regulate the calcium level. And if there's symptoms, if they're either hyper or hypoparathyroidism, can cause the subtle symptoms. So my recommendation, especially for the older woman, if you have frequently feel spasm, go check it. Make sure it's not another, like I mentioned. This will double another risk factors on top of the osteoporosis from withdrawal of the hormone, estrogen hormone, and if this parathyroid hormone is elevated, increased risk of osteoporosis and the fall. So that's the video for today, and thank you for watching. I will see you next time.